say you are waiting to receive it.
Yeah, I closed it. Hi, you're live.
Hello, I'm live.
Technical.
Good to see everybody on YouTube. Hello, and everybody here on TikTok. It's been a few minutes. March was a really busy month with a lot of conferences. So those of you that know me, I'm a traditionally trained OB-GYN who now practices integrative gynecology. And so in the month an integrative course, and then I was in San Antonio at an A4M course, and I'm headed next week to West Palm, Florida, and then the week after that to Mexico City. So it seems like conferences are all kind of bunched together. For those of you that are just joining me, I'm super excited about some new things that we have launched, and I'll come back to this later. One is a free hormone course that has been launched. The link is in my bio here, and if you're on Instagram, and I think on YouTube, we'll put the link there as well. So this is like a mini course for those of you that want more information, a compilation of videos that are a little bit better organized based on stress and hormones, acne, that kind of thing. We have a couple new free downloads. One is Natural Guide to antidepressants, but mood issues for women. That seems like a big thing that I hear about from a lot of ladies in menopause, but not even menopause, teens, 20s, 30s. So that link is in my bio as well. And then we have a perimenopause guide to testing. I get a lot of questions about what testing to do, what should I go to, what should I ask? So that is all available for you. If you are not subscribed here, subscribe or follow me here on TikTok. Subscribe to my channel, please, on YouTube. And also subscribe to our newsletter that is free, that comes out most Tuesdays. It just depends what else is going on. So I am here for about 30 minutes to answer whatever questions you are. And as I said, I'm a traditionally trained OB-GYN. I'm an MD. I'm not your MD. So I can't give you any medical advice, but I would love to answer any questions you have about hormones, about anything that you feel like you need clarification for, and if I could point you in the right direction. There's a little bit of a lag in the questions, so you don't need to list your question twice. I will get to it in the order that it comes. PBJ, good to see you. Do you test after menopause? I do test everybody, but it's an interesting thought. If you do not have ovaries, the testing could be a little bit different because most of the hormones, if you have your ovaries removed, are coming from your adrenal glands. It's a little bit harder to see that in the blood because that conversion happens in your muscle and fat. But yes, I do test progesterone, estradiol. We do estradiol, estrone, which is the form that is more common after menopause. We do free and total testosterone, DHEA, DHEAS. We do an AM cortisol most time, and we do sex hormone binding globulin. And if we're not sure if you're menopausal, we'll do an FSH and LH. Zyna, sweating so bad, menopause age 54. So sweating and hot flashes are usually from the drop in estrogen. More commonly, if you're not having periods, it's from low estrogen. Some non-hormonal supplements that could be helpful is Estrovera. It's a rhubarb supplement. There may be some help with evening primrose oil and also black cohosh, but you may be eligible to take hormone therapy. The risks, not the risks, but the indications are vasomotor symptoms, hot flashes or night sweats, prevention of bone loss, if you have premature menopause, which is before the age of 45, and also if you have genital urinary symptoms of menopause, which includes vaginal dryness, painful intercourse, UTIs, all those things. Okay, PBJ, my doc feels they fluctuate too much to test to get helpful information. Well, those people that are still cycling, yes, they do fluctuate. We have a well-documented cycle because when you go and you're trying to get pregnant, those infertility specialists know exactly where they should be on each day of your cycle. Any of us that have been infertility patients, I was included, I got blood drawn every couple days before my IVF. So we do know they vary, and we do know how to interpret them. If you're postmenopausal, they're not going to vary that much. They can vary across the 24-hour period, but that's why we're intentional about what we get and what we order. So thank you for those of you guys who are joining. I am going over as many questions as I can in the next half an hour about really anything. It doesn't have to be menopause or perimenopause. It can be any hormone issue. Let's see. Okay. I don't know if you guys on YouTube, anybody has any questions as well. We are recording for YouTube, and this will be posted on YouTube later. So if you're not subscribed to my YouTube channel, Tara Scott MD, or you can search it Finding Hormone Guru. You can also catch the replay if you want to watch it in its entirety. I do feel sometimes that YouTube is a little bit easier of a forum to search for a specific topic than possibly social media. But if you're not following me on Instagram, it's Hormone Guru MD. And as I mentioned, we have some great free downloads we have just created. One of them is about testing, one of them is about mood, natural treatments, and one of them is a free mini course. True manifest design, lots of clotting in the period. Thoughts? Well, we always think that if there's a lot of bleeding, that means there's a lot of estrogen. It could either be that there's a lot of estrogen or there could be not enough progesterone. Now, depending on your age, if you are a younger person, you may need to also be evaluated for a clotting disorder. But if you've already had a couple kids or you've had periods for a while, you would have been diagnosed with that likely before. And we always want to make sure that you don't have an iron deficiency. We do offer our patients tranexamic acid, which is not a hormonal therapy, but it's something that, like, when the lining sloughs, it kind of helps plug up those blood vessels to help for the amount of bleeding, heavy bleeding in pregnancy.
Sabrina from YouTube says that I cannot tolerate oral progesterone. Are there other options?
Sabrina, that is not uncommon for people to not be able to tolerate the commercially available oral progesterone. So let's just get a little technical about what that is. It's usually in oil. It's immediate release, which means you're dumping all the progesterone at once. Think about if you watered a plant once a week with all the water you were going to use for a week. It could only absorb so much and the rest is runoff. So some people can't tolerate it. They're groggy in the morning. They have a lot of side effects. So one of the things is it could be dose related. You might do better with the slower release. There are other forms to take progesterone. That particularly commercially available kind that you can get at your regular pharmacy like Walgreens is made for oral. But you could get a special pharmacy to make a vaginal form, to make a troche or a melt in your mouth lozenge form, or depending on your situation, if you're not taking estrogen, you can also take a topical cream. But when we get to people taking estrogen, we don't have any studies that show it will protect the uterus from the stimulation of estrogen. Pam Avalar 1, 4 months post hysterectomy, hope everything went okay. Kept my ovaries but just feel off. Can this happen? Yes, Pam. You know, with you not having a period, you would have no way of knowing if your period has changed. Now think about it. The reason for the hysterectomy is usually bleeding. Sometimes it's prolapse. So the problem that caused the bleeding still exists when you remove the uterus. Also, as a surgeon, I can tell you that we clamp off the blood supply along the uterus that goes to the ovaries, and people who take their uterus out and have their ovaries do statistically go through an earlier menopause, so you could be in the perimenopause. Bindi 108, would a uterine ablation drive body into menopause faster? Great question. What that is doing is using a thermal device to go through the cervix and burn the lining of the uterus, which is what builds up and sheds. So the thought is it burns it down to the muscle layer and you don't have a period. 30% of people don't have any bleeding at all. About 30%-ish or so still have lighter periods, and it doesn't help everybody. But I've had some patients say that there might be some chemoreceptors in that uterine lining that help them with their symptoms, and without the bleeding, they don't have the symptoms of PMS. Other patients still have that up and down of the ovaries producing hormones and still have the same symptoms. Dana George Holmes, I'm 56 and probably finished with menopause, hysterectomy 7 years ago. It's too late to start HRT. Great question, Dana. Thanks for asking that. The guidelines are pretty specific from the Menopause Society, and that says within 10 years or between the ages of 50 and 60, that is the best time for you to start hormone therapy from a safety protocol. Doesn't mean that you absolutely cannot start it after 10 years. It just means that you're going to get the most benefits and the least amount of risks at that point. Okay, Triple Purple Heart, great to see you here. Just diagnosed with osteoporosis. What dose of estrogen is therapeutic for you? You're in perimenopause. Well, let me just tell you, check out Dr. Doug Lucas's YouTube channel. He's got a lot of really great information about osteoporosis. There is so much more that you should be doing. Yes, I agree. Estrogen helps the prevention of bone breakdown, but it doesn't build bone. You need to have all your hormones checked. You need to make sure you're getting enough protein. You need to make sure you're doing body weight resistance, like weight training. Some of my patients buy one of those vibrating pads, and I do some extra osteoporosis screening. I look at a ALK-Phos bone specific that looks at the bone breakdown, and we also look at a CTX, and then we want to measure the bone buildup, which is a pro collagen P1NP. I'm probably not saying the whole thing wrong, but we look at those when we say, are you building more bone and then breaking it down? It's really important. So please go to somebody who is a specialist on this. But back to your initial question, you need to be on at least the 0.0375 dose of the patch. Angela Vanderpool, is there a hormone that causes shortness of breath and irregular heartbeat? That's a great question. There's a couple things. Cortisol sounds like it's definitely a culprit, but too much estrogen in perimenopause can also cause that. Thank you for sharing the live. 1, 2, 3, 4, 5. Can estrogen cause weight gain? Estrogen is like Goldilocks. Too much can cause weight gain, but not enough can cause weight gain. So it's a frustrating thing, just not having estrogen in the right spot. LKW, what can I take for menopause insomnia? Progesterone is great for insomnia in perimenopause, but if you don't want to take any hormones, I would try a little bit of melatonin. I like the Ollie Sleep Gummies because not only do they have melatonin in it, they have L-theanine, lemon balm. Sometimes patients have good results from kava as well, or valerian. We got a question on YouTube.
Yeah, Morius wants to know what hormone can cause loss of eyebrows and thinning of your hair.
So generally when we see loss of eyebrows, especially the outer third, we think low thyroid. However, low androgens can also contribute to it. That would be a low DHEA, DHEAS, or low testosterone. And for men, it's funny because high testosterone causes hair loss, but also low can as well. I'm thinking thyroid's more common. Cool Grandma 562, what causes me to sweat when the cold air hits my body? Is this menopause? It sounds like it's a little bit of a vasomotor thing. If you're not getting a redness to your skin, sometimes that can be a histamine driven thing. So yes, that does make me think that it could be the drop in estrogen. Zyna122, what dose of estradiol is recommended? Should you take progesterone with it? My opinion is you should always take progesterone with estrogen. Progesterone not only protects the breast and the uterus, there's some studies that show it helps you build bone, not break it down. It is brain protective. It helps. It's an antidepressant. It is a mood stabilizer and a sleep stabilizer. There's a lot of things that progesterone does besides for protect the uterus. I always start on the lowest dose of 100 of progesterone and 0.025 patch of estrogen. There's also estrogen gels that are 0.25. Let's see. I don't know what your screen name is. You got some emojis. Thoughts on autoimmune progesterone dermatitis for hives during luteal. Still getting diagnosis. That's a really interesting one, and I have heard that. I'm wondering if it's a biopsy that's making that lack of progesterone, not the presence of progesterone. And if you do have it, I'm also wondering if you had it during pregnancy, because you got a ton of progesterone during pregnancy. So those are things I encourage you to see someone who's able to check and interpret your hormones. Farm Chick, what about HRT made from bioidentical drops you just put on your skin, formulated just for you? I don't know. I know there's a lot of direct-to-consumer things. I don't know if they're regulated per dose. There's lots of ways that they can be compounded. So if you're working with an accredited compounding pharmacy, that could be, most of that HRT still needs to be prescribed. So if you're doing like a telemedicine thing, that could definitely be an option for you as well. Thank you guys for the rose. 1, 2, 3, 4, 5.
Brandon wants to know, what's the most common misdiagnosis you've seen over the years?
Oh gosh, that's a great question. I would say, if I really had to say it, I think for women, it's anxiety and depression, which is really a hormone issue. It's low progesterone, it's low estrogen, and they get put on antidepressants. I see a lot of people with migraines that are hormonally mediated. And if I had to say one more thing, I would say food sensitivities, which is either acne or gut issues, and it's really a food sensitivity. LBC18 says, what about gout? Gout is something that has to do with too much uric acid, usually related to also your dietary things. Not something I'm super up on in my wheelhouse, but we do know we would screen with it for uric acid. Elena K, thoughts on, lost your question. Hold on just a second. Progesterone for those who had just had endoexcision and is estrogen dominant. That's something I'm frequently doing for endometriosis. Some people are, their endometriosis itself is resistant to progesterone. That you have a lot of aromatase, which is an enzyme that converts testosterone to estrogen in those endometriosis implants. So another great supplement that you could take, Elena, is N-acetylcysteine. You want to take at least 500 twice a day. Resin Rocks, ovarian cancer, survivor granulosa cell tumor and can't take any HRT. No one has any REX. Thought that's very interesting. So granulosa cell tumor, I'm wondering how long ago you were diagnosed. That is a estrogen producing tumor, but I don't think, and again, I can't say this without checking the literature, and you're an individual case. That doesn't mean you couldn't take progesterone, testosterone, DHEA. Again, let me qualify that. It's probably an individual situation. I do have several patients in my practice that had ovarian cancer, different types. You know, there's a lot of types, and who are safely taking HRT. So you just need to go to a specialist. Dina, I want to go on an anti-inflammatory diet to see, is it an all or nothing thing? That's a great question, Dina. No, absolutely not. It's not an all or nothing thing. Take one thing at a time to cut out of your diet. If you just want to cut out dairy, just do dairy. That's kind of a big thing, though. Just do wheat. But you will get some benefits, most likely, even from a partial of that. But whatever you decide to cut out, be militant about that one thing, if you're doing one or if you're doing two, for at least a month, because you won't really be able to assess if it's helping before 1 month. So if you're saying, I can't cut out eggs, soy, all these things, just pick what you want to cut out for at least a month. Okay. I'm gaining a ton of weight, user 98014449. I sweat all the time, doing nothing, and I'm exhausted. I'm 45. User 98014, it sounds like you're in perimenopause. It sounds like you could probably still be estrogen dominant, and you might benefit from progesterone. So I would really suggest that you find someone that can work with you to check your hormones. And look, guys, the exciting thing is now there is actually a direct-to-consumer more and more of testing. You still need someone to work with you to interpret it, but at least the barrier of testing possibly is gone. Miriam, what's the optimal range for estrogen and progesterone? Well, that's a loaded question. There's one range for luteal, there's one range for follicular, there's one range for ovulation, and there's a postmenopausal range. So it really depends on a lot of things, and it depends on what you are trying to find out. Larissa and Aviana, I have a high heart rate even in the middle of the night. Extreme fatigue during the day, estrogen, 42. I am thinking it's cortisol. Follow up on my osteoporosis question, what dose of gel or cream patch? I don't use the patch. Okay, so if you're on estradiol gel, or it's commercially known as Divigel, the dose that you'd have to take for that is 0.5. Lilybet, 20, good to see you. What could the cause of perimenopausal woman with PCOS and adenomyosis, 22 millimeter uterine lining? So if you're still having cycles and you're having an endometrial stripe, it can be as high as 22 millimeters in your cycle. There's really no valid cutoff unless you're post-menopausal, and then we want it to be equal or less than 4. So a 22 millimeter uterine lining is not unusual.
From YouTube, Nam Arafni says, does DIM help reduce body fat?
So that's a great question. DIM or dianyl methanol is usually the same as cruciferous vegetable extract. It actually works on phase 1 of estrogen detoxification by upregulating cytochrome 1A1. My dad told me I'm talking too crazy. I need to make it easily digestible. So what that all means is there's 2 steps to getting rid of estrogen. That works on the first step. So if you have too much estrogen, it can help clear it. Your question was, does DIM
help reduce body fat?
Help reduce body fat.
Belly fat. Yeah.
Belly fat. That's actually not one of my things I would go to, because I think belly fat is usually for insulin. However, you do get belly fat in the stomach from menopause. There is a higher proportionate of estrone to estradiol in menopause, which could be driving that belly fat as well. So it could help, but it's not usually the thing I would do. I would look at something like inositol or berberine to target that. Larissa, when is too young to start HRT? Well, I guess it depends on what you're talking about. I've started teens on progesterone. I started taking my progesterone at 38. Didn't start estrogen till much later. But when you say HRT, are you talking about estrogen? It really depends on the clinical situation. Jacham 20, can hormones cause POTS flare-up? Absolutely. POTS is an issue with your cortisol as well. Postural orthostatic tachycardia syndrome is regulated by cortisol, and I see a lot of teen girls that have worsening on their periods or right before. Tamara Miller, should you take progesterone even after hysterectomy? This is my opinion, not necessarily the popular opinion. I've done several videos on YouTube and here on TikTok about this. When you remove your uterus, the gynecologist will tell you don't need a progestin to protect the uterus. That doesn't mean you don't need progesterone, which helps protect the breast. So if you're just still going to take estrogen, there are some studies that show there's an increased risk of breast cancer with estrogen only. There are some that show that when you take Premarin alone, there's no increased risk of breast cancer, but that was a small study. There are bigger studies that show there are, and that's not something I'm willing to take a risk for. Also, women feel better balanced. Every cell of our body has a receptor for both, and we give both together. That's not a popular opinion, though. That is my opinion. Chrome Stella, can you still have Hashimoto's even if your TPO antibodies run the normal range? That's a great question. So I actually just got mine checked. I've had Hashimoto's for 26 years, and my TPO antibodies were almost in the normal range. Still abnormal, but on the border. And that's because I think it's because I've been taking low-dose naltrexone for about 4 or 5 years now, and I've been lowering my thyroid dose, which is great. Also, estrogen can make your thyroid, when estrogen is high and low, it can make your thyroid also be abnormal because it increases a binding protein. So it really depends on what exactly they were, if they were abnormal before. 1, 2, 3, 5, full hysterectomy, how do I know what dose is right? Yeah, that's a hard question. Depending on what form of hormones you're taking, if you're doing a patch and an oral progesterone, we still do monitor via blood testing. We go both by your symptoms and your blood work, not just by either. Thank you guys for the gifting and the roses. Thank you so much. Biopsy, yes, I've never been pregnant. Okay, the autoimmune dermatitis. Yeah, it's a rare thing, and somebody like you, if you're my patient, I'd really want to do something called a cycle map, which is 11 different testing of hormones throughout the cycle, because I'd really want to see exactly what's going on.
Sabrina wants to know if you can discuss LDN.
Yes, I just was talking about LDN, so low-dose naltrexone. So naltrexone is commonly given for narcotics dependence. And so what we've seen is that the lower doses, usually given at 50 milligrams, the lower doses of 4.5 for autoimmune. If you want more information, go to ldnresearchtrust.org. Tons of studies, tons of information there that you can digest. We commonly give it in our practice for Hashimoto's thyroiditis, but there's some thought that you can get for anxiety, lots of autoimmune. So somehow, because it's a lower dose, it helps for autoimmunity. And as I mentioned, my thyroid function has improved. I've been able to lower and lower and lower my thyroid dose, which is great.
Number 1, we've got 7 minutes left, so get your questions in. Selena Brown on YouTube says, I've been bleeding for 15 days now. I'm 53. Please help. Cry face.
Oh. I would like to say that's not uncommon. It is not uncommon in perimenopause. If it's heavy bleeding, if I put on my gynecology hat, there is one therapy to stop the bleeding, which is generally a synthetic progestin, but then there's another therapy to regulate things. So there's the put out the fire and then prevent it. So it's not an easy answer, but I would definitely call your gynecologist. Chrome Stella, I read 90% of hypothyroidism is caused by Hashimoto's. Yeah, that's true. Namie's wife, can you have low progesterone at 22? Lots of anxiety, vertigo, brain and heart, normal CBC and lab. Namie's wife, yes. I am seeing so many younger patients that I'm testing their hormones at 20. The therapy is going to be different than someone at 50. But yes, I'm so happy to see people at this age and test them. Do you have a question? Or Okay, Camp Chaos. My cardiologist said after 5 years of HRT, the risk of heart disease goes up. Is this true? No, that is outdated information. 22 years ago, there was a study that showed that after 5 years of use, there was an increased risk of breast cancer and blood clots from a synthetic hormone. Right now, the Menopause Society, the latest position statement from 2022 in June, does not say that after 5 years, the risk of heart disease goes up. Okay. Julie Jones put on progesterone and testosterone for HRT last week, also diagnosed with Hashimoto's. I hope it's helping. Dina, why do I get 1 to 2 nights of insomnia right before my period every time? That's usually from the drop in progesterone mostly, but also estrogen. You got a question? Okay.
2.
Okay.
Nam wants to know what's the best way to reverse insulin resistance.
One of the quickest way is intermittent fasting or time-restricted feeding. An overnight fast, 3 days a week of 14 hours. That does it very quickly. Also, low-carb diet and spacing meals.
Second question from Blossoming in the Desert, 52, still ovulating, estrogen and progesterone tested daily with Mira, normal, DHEA normal, but testosterone low, 14 on DPO 7, still trying for baby number 8. How to raise testosterone with cycle, question mark. Pregnenolone, question mark.
No to pregnenolone. DHA potentially could have a better option. Ways to raise testosterone naturally: weight training, exercise with weight, increase your protein, correct any zinc deficiencies, and get 8 hours of sleep. Okay, guys, I got a lot of things. Well, I'm going to try to get through a few of these things real quick. I know, guys. I know we're towards the end of the time, and I'm trying to get through some of these. There's a lot of questions. Okay. Can high estrogen, low progesterone be related to low dopamine? Dopamine, Olga, is more related to testosterone. Hashimoto's, do I need to take synthetic thyroid medicine? Julie Jones, it depends on a lot of things, but know that every medication is generally bioidentical. Synthroid is bioidentical T4, so they are synthesized, but they are bioidentical. Should progesterone be taken during a specific time of the cycle? That depends if you're still having a cycle, then yes, usually the second half after day 15. Sue B, 745, hyperplasia, 64, 8 millimeters, no bleeding, not ready for DNC. If you don't want a DNC, you need to take a kind of therapy. So usually it's a synthetic progestin called Megase, and then a rebiopsy. Marin, could a woman in her 20s be diagnosed with pituitary insufficiency, be given HRT and benefit from HRT? Absolutely, depending on if it's a permanent thing or a temporary hypothalamic thing.
Jan says, lost the cycle because of COVID infection. Can it return?
Yeah, that has been also reported, and it's more of a cortisol-related thing from stress and the effect of cortisol, of COVID on your immune system. So it a lot of times can, depending on how old you are. Kate, wanting to get my hormone IUD out, any advice on supplements to take after my body? I would definitely do a B complex and magnesium. Warrior, I had stage 4 with full hysterectomy and ovaries removed. I'm on 0.5 estrogen now, hot flash. Patricia, my opinion is that you should also be taking progesterone. That's my opinion. Purple Heart, would you recommend to monitor adenomyosis on HRT, yearly ultrasound, estrogen blood work? There is no established protocol for monitoring that. I would go by symptoms. I always monitor hormone levels on all my patients anyway. Annie Fanny, I cannot get my OB-GYN to care about testing my hormones. I'm 49. Unfortunately, as a traditionally trained OB-GYN, I can tell you that we're just not taught how to do it. So you need to go to somebody who has been taught and knows how to do it. Lisa, wow, have you seen a correlation of menopause and lichen planus? Lichen planus is a little bit more rare than lichen sclerosus. It can be associated with low androgens, but also could be thought to be autoimmune. ABLD, I have Hashi normal labs minus antibodies on Synthroid. I legit couldn't be more tired. Is your doctor checking a free T3 and a free T4 and a reverse T3? The TSH may not always tell the full story. Olga, 1 to 2 months of long, heavy periods. What causes that? OB could not find anything. No hormones were tested. I'm glad they didn't find anything. That means you didn't have a cyst or a fibroid. But Olga, we would be taking your hormones usually after ovulation. Elena K, N-acetylcysteine 500 twice a day for endometriosis. Yes, I see. And I don't do surgery for endometriosis anymore. I used to. I do not. I haven't done that for probably almost about 10 years, not quite. So we work medically with hormones and doing with that. Okay, Sydney Watch, estrogen patch in upper buttocks. Have you seen better absorption? You know, that is a place you could put it. And I think some people do. If you don't have a lot of fat, they do a little bit better. Kenzie Davis, my PDG was 6.54 on day 21. Usually, depending on the lab, we usually want it to be on 10, above 10, but it depends on which lab you went to. Sherry, my doctor says I need to go off of HRT at 60, 65. I'm in good health. Any suggestion? Sherry, the Menopause Society does not have a date that you have to go off of hormones. The American College of OB-GYN does not have a date that you have to go off of hormones. The Endocrine Society doesn't either, so I'm not sure where your doctor's getting that information. I see you have a Canadian flag, so maybe it's just an older guidelines. Triple Heart, do you ever prescribe more than 200 progesterone when taking estrogen? Yeah, a lot of times if I'm going to do that, I'm either going to do 220 that's compounded in a slow release or a topical and an oral. Jellyfish, thank you for the compliment I had. Today was hair washing day. Miriam, I have a hard time losing weight. Okay, yeah. Thyroid, cortisol, adrenal hormones, and female hormones. Okay, guys, I'm sorry I did not get to all the questions. Thank you so much for all the wonderful questions. As I mentioned, we have some free things that we got. We have a new free mini course for you. My link is in the bio here. If you are not following me here, please follow me here. Head on over to YouTube, subscribe, head on over to Instagram, also Hormone Guru MD, and also subscribe to our free newsletter. We've got 2 new free downloads. One is the testing guide for perimenopause. Half of the questions today were on testing. Go get our guide. It's a free download. Also, there is a free download on natural therapies for mood disorders, depression, and anxiety. We've got a little bit more to come. Did I cover everything? Subscribe to me here, YouTube, and here, check out our new free downloads. Oh, and sign up for our free newsletter that comes out on Tuesdays. Good to see you guys. Normally I'm doing Tune In Tuesdays at 7 o'clock Eastern, as long as I'm not traveling. It's kind of a little bit busy the next couple weeks, so I'm going to try to hit as many Tuesdays as I can. And thank you so much for tuning in with me. I appreciate all the gifts.